Here to talk more about the findings is Dr. Elizabeth Clayborne. She's an ER physician, an adjunct assistant professor of emergency medicine at the University of Maryland. Dr. Clayborne, welcome back to BNC. Let's talk about this new study. It debunks the claims that the COVID vaccine and infertility are linked. What do you think about this study, and do you think it will convince more Americans to get the vaccine?
Well, I was really happy to see that we actually have some data that we can point to because this is a very common question that a lot of young people have, especially those obviously interested in conceiving and getting pregnant. And as a young mother who was actually pregnant at the very beginning of this pandemic when we had nothing, no PPE, no vaccine, I intimately understand the concerns with wanting to do what is best for me and my baby, who I'm trying to carry into, this world safely. And so I had a lot of family friends who were hesitant to get vaccinated because they had questions about fertility and what it meant in the long run to get vaccinated and then want to have a child. So it is great that this research that was headed up by epidemiologists at Boston University is showing very strong data that, first of all, there's no connection between infertility and the COVID vaccine in either men or women. But what is also interesting is that actually it showed data that is demonstrating that men who were recently infected with COVID had decreased fertility. And so I think that this gives us a very strong soundboard to now let people know who are concerned about conceiving that the best course of action is to get vaccinated. It is best for you and your current babies and any future babies that you have. And so I'm very pleased that we have data now to support that, that hopefully will help convince those who have been on the fence and concerned about this particular issue.
Well, I'm excited about your optimism and congratulations on being a new mommy. I'm sure that couldn't have been easy being a doctor and delivering and a COVID pandemic and all of that. So, kudos to you. What about the long-term situation, long-term fertility? Researchers doubt that there are any adverse effects, but does this concern you at all?
Right. So I think this has the same message. This study shows once again that there's nothing that was occurring in these couples that are indicating that there are going to be any long term implications in fertility connected to the vaccine. What I think is more concerning is the long term implications of a COVID infection. We are continuing to see the complications of people who have long COVID, and there are particular symptoms of long COVID that can impact your fertility. So I think that the message should actually go back to that it is much more risky to get infected with COVID and have potential problems with your fertility rather than getting the COVID vaccine, which protects you potentially from having that infection and certainly would make it more likely for you to be safe if you did get COVID and not have any severe symptoms or long COVID complications. So, to that question, of course, we don't have definitive data and we'll have to see over time. But I implore everyone who's really concerned about this to speak to their OBGYN, their primary care doctors, and those that are helping make these decisions because there is growing mountains of evidence that are showing that even in the long run, the best thing for you to do is to get vaccinated.
Absolutely. And I mean, you being a new mother as well, I mean, would you like to see your baby being vaccinated? Not sure what age he or she is at right now, but I mean, that's something that parents
Absolutely.
are looking at.
I Ironically, my entire family just recovered from getting COVID. And so I have a 19-month-old and a 3-year-old, both of which are obviously under 5 and unvaccinated. So I've been for 2 years now concerned about bringing COVID home to my family and infecting, especially my children who are unprotected and unvaccinated. And I was fairly devastated, right, when they got sick. Fortunately, they had mild symptoms and have now fully recovered. But I think that this brings up an issue that has gotten a little bit of publicity, but is still really pertinent to this particular time, which is that parents with kids under 5 and parents who are interested in getting pregnant and having babies are very stressed right now, and especially those who are serving on the front lines. I continue to go to work, and I knew that it was going to be a risk, and I did eventually bring home COVID to my family, and things could have gone much more serious than they did, and I'm fortunate that I happened to be in a population, where my kids did well because I have seen it turn the other way where kids don't do well. So I think that, I am certainly looking forward to when this vaccination is going to be available for our kids 5 and under, because there are tons of people out there who have concerns like me as a mother with young children when it comes to sending them to daycare, being able to just socialize and making sure that they're also, meeting their developmental milestones and having that socialization that is important and weighing those concerns with, their actual health and safety concerning COVID. So I hope to hear good
That is
news soon when it comes
so
to vaccinating our 5 and under.
Yeah, that is so amazing to hear that. How did you comfort your babies, two little ones, when they have COVID? Because you can't really give them any
You know,
medicine,
it's
right?
It's really challenging. I would implore everyone to make sure that you're thinking about those in your community who are dealing with this childcare issue. When I talk to my friends, whether they're physicians or not, a lot of us are having the same problem where their kid gets quarantined, can't go to daycare, can't go to preschool, then they're home. And as a parent, you're trying to juggle having, your kid at home. And it's not the same as a school age child that might be able to do an online course. My 19-month-old is running all over the place and needs constant supervision. So I can't get anything done when she's home. And if they're sick and they have COVID, that makes it even more concerning. Not to mention the guilt really that I felt, about bringing home that illness to them. So please, remember to encourage those in your community who are dealing with this issue. I fortunately was able to rely on my parents, who later got COVID, but at the time were, able to help me just before our illness so that we were not, basically having to always survive on our own when the preschools and daycares were closing down. But not everyone has the resources that I have. And a lot of people are struggling during this time. So please, be mindful of the community that you're in, even your own family members that might be putting on a good face, but are really struggling when it comes to taking care of their family and themselves.
Well, great advice. And thank you for sharing your story with us. Again, you're amazing being a doctor and two little ones at the same time. It certainly isn't easy. Thank you for all you do. And thanks for being with us here on BNC, Dr. Elizabeth Clayborne. Take care.
Thank